Today, now the 25th day of March 2021. IGR and other development partners them, they say they do a survey na Sierra Leone for check with healthcare system and the education system na the country. Again, I say Usai, na the country, na Sierra Leone, not to free tongue no more. Because anytime you want to talk about Sierra Leone, then go one base no more on Freetown and forget about then get how they call it, the hard to reach areas. And that word they first, now me I get problem with hard to reach areas. Hard to reach areas, now because we not make the road, and now because we not get sustainable means of transporting things them from one end to another. So let's say if now for cross water, we get a boat system, ferry system, where they up to par for cross with people them. You know go call it hard to reach areas. Not so. If now outside the road where you don't pass down, you look behind, you see say, that kind of way they and not think say now I will pass. That's why then they say hard to reach areas. Hard to reach areas, now areas then where the government of Sierra Leone neglects. Now in a hard to reach areas. Hard to reach areas, but when it comes for election, those people will vote. When it comes to election, then go reach them. When it comes to development, then call them hard to reach areas. But I wish those people within a then hard to reach areas, so-called hard to reach areas, know their rights. But you go say, why we focus on so far place system when I had to reach areas? Or one say, even for cross Lunge, Lunge, what you go and say? Lunge back na hard to reach areas because it's not easy to go across, you know. It's $40. The common man can't pay that money. Yes, the ferry system, but you don't see ferry lately. You say they choke. If water not drift farm or what's not. Even though in the city, I have a belief say for cross Lunge self we will say hard to reach areas. Even though, you know, as hard as the other areas them. Yeah? You know, as hard as the other areas them. But then go still they tell you about hard to reach areas. If you make the road, trust me, you not go hard for goodie. Yeah? We they see the fire incident there now. The one at Mount Royal, fire first not able goodie. When the camera go interview the chief where they did. The chief say, now the government no want for make road. He said if the government want for make road, then they make her. And that's true. Who they able fight government? If government say, now yeah, they pass road, give the people a waiting and deserve, then put the road there. Look Mabela. I make her say, the government not go get mind for do it in me they think say, then for do. Half of Mabela is gone. You don't tell that they say commodity. It's unfortunate fire come like I cancel and brush off the place. Yes, it's rather unfortunate. But me wait till they think. That's how outside the fire don't catch so now. Now for build tranga wall lay. Tranga wall line for building now. So that people don't go come back for cancel then. Because we don't pass wall from if na so pit or yanda to fisheries end. You don't secure the place. Who da go can say government of a build fence day? Then the government can man up and take responsible action for make the people them relocate them, find somewhere for them. But no, who's the election get for B? Just over the corner. I beg you, let them say and they can't give people a notice. Then we election can not vote for them. Okay. Anyway, we talk about health and education, the latest report. But let's join NACOVAC quick. Yeah? Let me hear what's in NACOVAC say. They say today, now 448 tests now in the labs they analyzed. And out of that 448 tests, nobody not test positive for COVID-19 na Salone. So today Salone, 0. So because we get 0, we did like yesterday. The total number na 3,953. For the death, for the past 24 hours, nobody not lost in life to COVID-19. So we still stand at 79. The one that in isolation, now 1,076. The one that don't recover, now 2 people for the past 24 hours. So because of them 2 people and there we get 2,798. The one that in quarantine, now 33. The one that on discharge from quarantine, now 14,642. Let me check Mano River Union countries them. Today, Salone self say, they not mix, they not show face, 0. Guinea, 148. Then if you say then do something. Liberia say, then self not show face, 0. Ivory Coast say, una de pa the 00 and what not. Me, they represent, and when I represent, I go big. Today, Ivory Coast, 439 new cases. 439. Hi. Okay. With a total number between Ivory Coast and Guinea, no more 587 new cases them. Now the Mano River Union countries them today. The cumulative death. Salone, 79. Guinea, 113. Liberia, 85. Ivory Coast, 224. Yesterday, Ivory Coast now be 222. So Ivory Coast don't lost 2 people within the last 24 hours to COVID-19. We don't get a total number of 501 new cases. Now the Mano River Union. 501 death. Now the Mano River Union countries them. However, to Kikabase, he say Ivory Coast is unbecoming. He really want to know waiting they go on na Ivory Coast. I they tell you, Ivory Coast? I don't know. But for one reason, and things say nobody not for contend with them. So now them for always the lead. So even the same way Guinea can make like if I say one kind way, then can just leave Guinea no more. Then later, then show up DT invoice bigly and show up bigly. But to make we go to we program proper for today. As I've been telling you in the intro, IGR, Institute of Governance Reform, and other development partners then come together and say for take a survey on healthcare and education. They're not just up an Afritongo. Across the country, and as we all know, it not change here too. At the same thing no more. At the same thing no more. But through radio democracy, when I make you listen here, how the reports be take place today na Radio Democracy 98.1.
The Institute for Governance Reform IGR, they work now for promote public sector accountability, advocate for make they reform the public sector, and serve don't they do research on different social issues them where they ambog national developments. And this being term, they do survey on service delivery, we focus on health and education.
Service delivery. We focus on waiting, health and education. It's about a service delivery, How the people where then they give them service then too. Waiting then think say the service where then they receive. if na wetin government say na im dem dey receive, or how this service stand like to them, and even the one way they give the service, how they think about delivering those services in waiting, health and education.
USAI IGR, together with them partner them, don't launch this survey. And Wula Valley, now the executive director for IGR, it starts for talk about who that's them, this survey been targets.
We looked at 8 indicators in education: effectiveness of community oversight, access to textbooks, learning outcomes, user perception of school services, infrastructure, access to radio teaching programs, COVID preparedness of schools, and then human resources. In education, you can see learning outcomes, where we took the entire results for West African Examination Council results for primary schools. Access to qualified teachers, this is school census that was done by the Ministry of Basic Education, and school infrastructure data. So those are secondary sources of data. But primary sources, we interviewed 3,960 citizens across the country, looking at 660 facilities, education facilities, and 490 peripheral health units. It means scientifically, for each constituency, we interviewed 5 schools and 3 health centers.
And Wula Valley continue for talk about some of the team them where they fell not at the education sector.
So this is the overall results for health and education. Out of a score of 50 on average, the national score for education is 33.7. The national score for health, 25.2. So you can see the most challenging districts are Karine Moyamba, Falaba, Koinadugu, and Tonkolili. And we, at this point, we really want to encourage development partners. These are some of the most challenging districts. When you look at access to education, Western Urban and Bonth, again, you begin to see why Bonth moved up. It's become, Bonth did very well in education over the past 5 years. 80% of constituencies with good service delivery are in Freetown. Now, we are not talking about the annuals. We are talking about government schools compared to government schools in rural communities. But the greatest concern is human resource. We only have 45% of human resource deployment, that's access to teachers.
And Wula Valley end up say, some challenge still day for make upline school them get access to quality teacher and other facility them. As this survey, same way so gets for do with health sector. Waiting at some of the team them where them fair notes. Fredley Mokomok Hale, now the Director of Research and Policy na IGR, he explained.
Access to drugs. For this indicator, we combined 2. We looked at 2 variables. We looked at access to drugs and the percentage of people that said that they had to pay for treatment for free healthcare in the communities. What we saw is, again, drug availability is actually more of a problem than payment. So in the way that payment for education was low, people saying that they didn't have to pay so much for education. Similarly, in health, you had a smaller percentage of people that said they had to pay for services that should have been free. So we can see that Cambia, Western Urban, and Pujon are the ones that are highest when you aggregate the 2 variables. And then Karine, Bonth, Tonkolili, and Kailaon are the ones that are struggling the most when it comes to payment for health. But Koinadugu actually has 1.67 out of 10, which is really low when it comes to availability of drugs.
This project, now IGR and Oxfam Saloon, been take the lead for Duam, where this make the head of programs na Oxfam Saloon, Innocent Mutabaruka, been talk about what this reports mean for Saloon people them.
You know the role of education and the role of health it plays in our daily lives. And as we launch this Service Delivery Index report, we'll actually be committing all of us, collaborating with each other to ensure that we move forward with this process and to ensure that we cause an impact in the lives of the children and the people we serve.
Where they launch these reports, the country director for World Bank, Gail Martin, say government for ensure say then take proper action to address the issue of health and education. Where the report shows say some challenge still there for make people now the upline parts them get access to.
While some of the findings highlight challenges, there are also important opportunities. What is critical is how the findings inform progress moving forward, and citizens, CSOs, and public officials will need to collaborate closely in identifying innovative and effective solutions. I have no doubt that there is a commitment to bringing about these changes. It is critical that action must be both at the national but also importantly at the local and community levels to bring about the change in these inequities.
This report. Now, one way the leader of government business na parliament, Honorable Matthew Numa say, then go work for CC, they address some of the issue them with the inside the reports.
As parliamentarians or we in government, we are not there to question your data. What should be put in place is how do we make use of the data.
But yeah, I want make we read this back. This particular one, I'm not sure for other one no. Dear, when I read this back, no, yeah.
Government, we are not there to question your data. What should be put in place is how do we make use of the data. I believe in positive engagement in the dispense of governance.
Okay, now the leader of business, the same one them when he began to that perception survey about parliament being corrupt. But this time around, he said they know they question the data. This time around, they no question say wait ba, how many people were on an interview? They say na 3,960 people. They no question. Before, they questioned about the perception about parliament being corrupt. So what we go say kudos to them? Say then they question this one? Or is it because other development partners are involved in this one now? So then things say they're not for question them. Eh? Alright. Continue, sir.
So what you have done, the data you are giving us, we should first appreciate the data. We do not need to politicize some of these things. What we only need is to create the space. We can all work together and achieve a common goal. There is lacuna, but you are now trying to close the lacuna. From the look of things, you can realize that there are districts that are suffering. You talk about the available facilities that they do have compared to the urban center like Freetown. And let us transform all of these to a positive change in our democracy.
Honorable Matthew Numa end up assure IGR and then partner them say, them as member of parliament them ready for work and help improve on service delivery. So the people them na them different constituency. For Radio Democracy, Princess Pierce the reports.
I want to say thanks to Princess Pierce and Radio Democracy because not true they make me able for listening to this. Yes, this is 2021. We talk about the service delivery for health and education inside Sierra Leone. You go believe say Koinadugu district out of 10 where they mark them for accessibility to drugs, out of 10 then get 1.67 accessibility to drugs, out of 10 then get 1.67. If you didn't mark somebody out of 10, you get 1.67. What do you go tell them? Is that a fail? Is that a keep trying? Is that non-existence? What do you go tell her? An entire district. Medicine, no day. And they say some of the districts, even outside and say free healthcare system, then they still take money in at the people they hand. You want me to tell you the reason why? Go check na them places then they. How many people will get PIN code? Go check na them places then they. How the nurses and the community healthcare center people them they survive. I tell you no say. Now through that way they can they do the people then so. Is that good? No, it is not. But we government don't take them upon themselves. The Ministry of Health and Sanitation don't take them upon themselves. Forget free labor. They no want for pay. Then they pay volunteer. Volunteer. Now you know more. Volunteer. It's just that they not agree for talk. Because the next people for they go do now the provinces, so for they gonna each then community healthcare center then. Not for go ask nothing no more. How many people in a payroll? Eh? How many people in a payroll? Eh? They will go find out say, but man, not in a payroll. So because of that, now they then dabaru attitude here they come off from. But again, who that supposed for supply the drugs them? Is it not the government? Oh, they talk government and not can just not can say that the ministry. The ministry is part of the government. Yeah? So because someone go say just no, everything that they say the government, but now the ministry itself, yeah, and it's part of, not a part of the cabinet. Exactly. So now them, we then can get a retreat. We think they go sit down for talk. Now for just go no more, for go get the, is it item 13? Do they still have that in Sierra Leone? Eh? Or will they come up? You know what they call item 13? If you see go invent, if I see we get, item 13 are they wait for. Would that be they make the is it menu or order of program? Then that number 13 and then they put refreshments. Eh? Now you go begin item 13. But IGR say then interview 3,960 people. For the school facilities, them now 660. And for the healthcare facilities, them now 490. And they engage. But one thing where they make clear to we, for say drug availability and access to drugs, it is very, very low. Very low. All side. Usai, they say na free healthcare, so get free healthcare for under 5, eh? Then they still take money na kumra de hand. May I just give one reason where me feel to say, na in the aid and abet for make people them, they take money na kumra de hand. Because they feel say na the only way that they then get medicine na them bagre for sale. For check your blood pressure, for check your sugar, for check all those things, you they pay them. And so then say they survive. Because the government say let them volunteer. If they catch volunteer person here, you go feel say it is under payroll. Okay? One important aspect where the World Bank representatives say, he say, forget proper action for address health and education. He say not to national level no more. He say but the local and community for own arm. I think we don't miss a lot of times in that area there. Community responsibility. Eh? Well, the local government now, until we see what thing they go on, eh? At the local government side. Because if the local government not able for team up fine, how you think say the community go able for own stuff then like this? It will be a difficult one. For sure. Because community them, no one for man up. Community, no one for take responsibility. How? You go on for ask. Because we go to community now, we turn the camera to them, all they shout is Papa government. That's all the community they know now. Papa government, Papa government, Papa government, Papa government. You even now go to the councillor, inside they say Papa government. You go to the headman, he say Papa government. You go to the chief, he say Papa government. You come out to the parliamentary and they say they look towards the government. So who that go take up the ownership now say, let's come with a scheme where we go able for build with community together. Alright. But there are some fundamentals like drugs and accessibility that's got to be on a national, and they left to the government for provide them. But anyway, like out Usman Tholi, make we hear wetin he get for we on this one. Yes, Usman Tholi, welcome on board, sir.
Okay, now we thank Radio Democracy for the information. And one thing we are going to say is that data is important. And clearly, this data is showing some of the challenges then when we get not only now the education sector, but also now the health sector. And one of the things that will come out clearly from these studies is that the head of government business, when Honorable Yuma, and make some positive remarks. Because AAA, me and you know, say, when it comes on data, it's always difficult for the parliament accept the data. And last year, one of the surveys where IGR, one of the Institute for Government Reform, together with CAL, one of the Center for Accountability and Rule of Law, then they conduct one survey, we then come up with the outcome of Parliament being one of the most corrupt institutions in the country. We all know what is the response of Parliament to that. Most of them come out publicly and condemn the studies. So this is why they say, well, first of all, we therefore appreciate the fact, say, the head of government business, the leader of government business, when Honorable Yuma come out and encourage other parliamentarians them to make the accept the outcome of the study. So kudos to them, and we remember what in the Commissioner for Anti-Corruption Commission say when Francis Ben Kaifala we talk say the first sign to recognize a cynical human being and for reject science and data. So this now an indication for tell you say I think say they don't learn the way forward. Say you see one thing about survey where the brother then fail for understand about data is that it will help you for make an informed decision. Yeah, it's so exceptionally important in terms of national and international development. And also, as you say, AAA, in terms of local and community engagement. Very, very important. Not to turn for beginning to question the data, especially for credible institutions like IGR, CAL, you talk about Afro Barometer, and all the likes of it. Those are credible institutions where they come up with data for helping them for plan ahead. But if they come out constantly, they try to reject those studies, those reports, I think we get a serious cause for concern. So this is why I say, first of all, we have to say thank you for accepting the data. Now, let's move on to the data proper, and then I will make my own conclusion. AAA, as you say, so this is a very important study. A study where concentrates on the flagship program of the present government within the education sector, and one of the struggling sectors then we now help. We hold on to raise a number of concerns over the health sector, and we see in the likes of COVID-19 and also Ebola, how those emergencies, talk about those shocks, how they expose the health sector. It just tell we say we have a lot of challenges when it comes to them two sectors here. More importantly, that of the health sector. And this study, it just gives you an information. And if you listen to the director of IGR, Andrew Lavalley, don't forget, look at some indicators then, about 8 of them. Yeah, and look at those using primary as well as secondary data. Primary data mostly is about asking people, questioning people involved, stakeholders. And then secondary data, mostly about reports coming from some other sources then. And look at those critical data, and then they report on both the education sector as well as that of the health sector. One thing will come out clearly, out of average of 50, the educational sector, they say we get 33.7, which is not too bad. Because you're talking about an average of 50. But what is so challenging is that of the health sector, which is 25.2. That is slow because health is important, significant, exceptionally important, And the health sector is part of Maslow first phase of pyramid, hierarchy of needs. Then you put them under physiological need, when the basic, because most amount are we well, you able to do other things then. We know well, things like going to school and other things become insignificant. So health is one of those important physiological needs. So it's very quite low. And one thing will come out clearly, especially in the health sector, they say the access to drugs, as you say, AAA, is a fundamental problem. Especially in rural areas. And this is what we talk in terms of governance. Freetown, not in Sierra Leone. AAA, you mentioned that. Freetown, not in Sierra Leone. I think, then people here where actually the rule we get to understand this. Say, Freetown, not in Sierra Leone. Access to drugs is exceptionally low in rural areas. Konadugu, for example, AAA, I think you mentioned that. Yeah, out of a score of 10, they only get 1.67%. Very low in terms of accessibility to drugs. Yeah? So, this is important of them study here. It is up to the government for go back to the drawing board and say, look, what did they go wrong in a year? Why is it that in terms of the score, we score very low in terms of accessibility to drugs in areas, the rural areas, especially areas like Konadugu and you name it. So what can we do for forge ahead? What can we do for provide those service, access to drug to the people in the rural area? What did they go wrong? Is it about storage? Is it about the supply chain? Is it about, you ask yourself some fundamental questions. And for some of these studies, then they give some recommendations of a forge ahead. This is the importance of data. This is the importance of studies. We don't do it in analysis, you don't do it in data, and they come up with some recommendations. What is the thing for move ahead? This now, we listen to the head of Oxfam Nasalo, when Innocent Baruka, they give you recommendations as how the government and the community, Nasalo, for work together in collaboration with the international partners then, in order for help in the development of those critical sectors, especially access to health. Yeah? And in terms of educational sector, I think one of the indicators then, where is then they lag behind in terms of teachers, access to teachers and other services then. And the rural area again, rural area. Freetown, we will say relatively, it's okay. But when you go now to the provinces there, apply. I think say teachers then, access to teachers is quite low. Maybe, in terms of delivery, access, the teachers, the delivery, maybe poor, and they, maybe in terms of resources, textbooks and other things, maybe they are lacking there. So that's the importance of that study here. So, Minister of Education and other stakeholders for Sudan now say, look, this is what IGR don't come out with. So where are we going wrong? What's the best way forward? Yeah, what are the recommendations? What are the recommendations? Which one will they take in terms of recommendations? Which one are we going to address? And which ones are we not going to concentrate much on? Those are some of the critical questions then, where I see some of the institutions here were involved in this research and for still now for talk about. And the importance of the survey is based on people's perception. You listen to Andrew Labali in submission, in analysis in terms of the critical indicators then. And it talks the interview people using using primary data and also some other sources then. So that show you the feelings of people. It show you what the people then think. Because don't forget, the overall effectiveness of service delivery is about the impact what it causes on the people then. Whose impact will it cause on the people then? And the people then, now they make up the country. If they are satisfied, it will tell from the data. If they are dissatisfied, it will tell from the data. Because they go out there, interview people, and they know people and perception about that service. Yeah, about that study will help you for determine what is the overall majority of the people and think about the service. And it comes out clearly from this study that although there has been progress, especially in education, there are some critical areas that they need to pay attention. For example, like we say, access to teachers and other resources, textbooks, you name it. Yeah? So that comes out clearly. And the area where we are lacking, the sector, what is critical in the development of the country, are the health sector. And when you look at the health sector specifically, I think the area where they emphasize is not about people and for pay. That's not the question. Yeah? Although they pay, it's not about pay. It's about access. It's about access. How do we access the drugs? And I think so when they carry out these studies, one of the data is focused on COVID-19 preparedness response. How the impact of COVID-19 in terms of health and the educational sector. Yeah? And we all know the impact where COVID-19 caused in the health sector. And when I make the intro, I indeed mentioned that, COVID-19 as well as Ebola exposed the weakness system we'll get in the health sector. And this continue for portray up to this COVID-19. Very, very important. So the government need to do a lot in terms of the health sector. And as I highlight, it's exceptionally important for recognizing for a human being for able to function, correctly, for do all the things then, you therefore be healthy. As equally important as food, and in fact, food is part of our earth, because you therefore be, you therefore be nourished, you therefore be, for able to perform other functions then. So now a very critical area in terms of the impact they cause in the lives of people. And one important submission made by the country director for World Bank, Gail Martin, he said this is the time for us to collaborate in order for able to identify innovative and effective solutions. We have to be innovative. We have to learn to think outside the box. Government in, government out. I think one of the things that we then learn for the encourage in that country today, for encourage people that for be innovative. Work with people that not to come out, begin a bash, blast studies, blast data, talk bad about studies. The same people then where they criticize IGR, with the Institute for Government Reform, and that of TAL, where talk say Parliament, one of the most corrupt institutions in the country. Today and then come out, accept the data, encouraging other parliamentarians then to accept data, because knowing very well that they listen to some of the international partners and report, and the likes of the World Bank director, country director, Gil Martin, listen to the head of Oxfam, Nasalowi, Innocent Paruka. They all come out, accept the facts, accept the result, accept the studies, and say, look, we just need to work together, but we accept, we set back them. We challenge, these are challenges where they identify, and tell me the weaknesses then. Where we all need to work together, collaborate, and forge the way ahead work on those gray areas for moving country forward. Maybe they accept, just say, what, let's encourage we all fellow citizens, fellow parliamentarians then, for not to accept this data and move for the way ahead. But overall, to conclude, AAA, their study are very important, not only for community development, as you say, AAA. I mean, for international and national development, but also for community development. But I think one thing where you raise, you say everything government is about government. We are not saying everything is about government, but what we are saying, government for lay the foundation, for let we try to move forward. In terms of national, in terms of local development, in terms of community development, if they put the infrastructure, some of these things, just put infrastructure and make sure you empower people then to become innovative and effective. And this is why we continuously bash the issue of corruption, which is an attractive thing where make people and politicians they move towards politics. If they make a non-lucrative career in our country, I think that will help exceptionally in the development of we country. And so I will stop here, allow the chance to other panelists. Then thank you very much, AAA, and thanks to everybody who is listening to this program. Thank you, sir.
Thank you very much, Usman Toli.
Thank you, sir.
Yes, sir. Make we come with Doctor. Make we hear waiting in get for we today. Naya. Welcome on board, Dr. Isatuka Kejalo. You get the platform.
Yes, hi, good evening, everyone, and I hope everybody to do well, and good morning to many others. Thank you, thanks to 98.1, Princess Pearson, and Usman Toli, along with the one that we do this study. First, I think I want to say the reason why the Inspector General for the IGR no go reject this data, because there was not any limitation to the study. Meaning, when them been do this study, there was a comparative report with them present, and also the data clearly shows then survey more people them or more hospitals them than more than half. So there was no limitation for let you go reject this type of data or this type of report where they clearly talk about, the accessibility to healthcare along with accessibility to drugs where it can to somebody in health. And so many factors then they play where it can to that. We get to understand that because why? We government, as we always refer to, the reason why they refer to the government, you don't make it clear, Usman told you don't make it clear. The system, that first step, at the government in your responsibility. For ensure then put measures them in place, then put things them in place where it go make it easier for the ordinary citizens then for access healthcare. Then you leave it up to them and the clinicians them for ensure the clinician they do in your part for diagnose the patient, for provide the treatment we then deserve, and then that person they now get the responsibility for ensure take in your health seriously, for make sure is seek medical help where in need for, or mention you know what, when I don't prescribe me this medication, but I not feel I go able to afford them. Because one, people then they worry about certain things, and when you talk about health, one then they say I not get money for go see the doctor. That's not number one. And they don't understand when you not get medical treatment, we then discharge you need for actually mention that. Not to everybody understand, because sometimes even who say you get patient them where they find it very difficult for buy their medication. Then they focus more on food. And now them patient then they see who say the care manager, the social worker, upon discharge, everybody they come on board for ensure waiting at the resources them out there in the communities them for make this patient get access to food and then prescription or medication at a very low cost. You can also see now here in the United States, patients that were not able to afford medication at a higher cost or brand name, they see where then the doctor they try for search which place they where go sell this drug at $4. Like we can always refer, because working in primary care they refer the $4 drug list, right? And where we see some government hospitals then they offer the patient the drug at $2 cost for a 30-day supply. The reason for that, they don't want to let the patient go in a house and knowing that they get health condition will require treatment and management. So sometimes patients not even tell the clinicians them, now we country, because they think about that. Then they first think about the food what they need for it. If they not get sufficient food, waiting na medication now you go talk about to them. First you get for it. As Usman Toli say, of course your nutrition, get for go hand in hand with your medication where they take. Then that's why if you see, then you always talk about food and drug administrations, not to only for that interaction where the drug and the food can cause some food and they interact with certain medications them, not to only for that. It's also for ensure some medications them you have to take it with meals. So you need that. Even patient them when not get they would take PO like things them by mouth, right? Then can put them on fluids because they know say if you don't do that, they fall into so many different things whether not dehydration, whether not hypoglycemia, and many other electrolyte imbalances. So we can see that happening in the clinical setting. But again, we definitely feel this study was a good one for let we really see the deficit where it can to we healthcare system in the country, and that it's time, and we've been talking about it, that government need to put in resources into we healthcare system. When you compare the healthcare with the education, the percentage where me get when at the 22.5%, I believe that's USA will stand. I think that's pretty low. You can score that on 100% scale. It definitely shows that we are underserved when it comes to we healthcare system. And now make many people them can die. Because why? Then they find it very difficult for access medication when they don't diagnose them with, certain illnesses. Yes, we understand, say, there are certain illnesses that where people then they get free medication for, way like, I believe now the malaria, now one of them. And then the maternal health, I believe, say, Beloma and them forget free access to healthcare unless that's it's not happening, but I'm sure that's something we believe it's happening for many people them or many communities them. So as denting and they don't they in place, why not talk about the most common illnesses then where they happen for provide access to them medications there for the people then we really then they diagnose with at a reasonable cost, and ensure say then people there get other help and support in the community. We can to, food, we can to, clean drinking water, and we can to follow up as to who that then will reach. Do we have social workers in these different communities? Do we have, care managers that can follow up with the patient, after discharge for say, how then they do? I don't say these are all things we see in the West or overseas, but these are good things to model. These are good things to want for your country, and we should not defer from actually talking about that. We should always continue to talk about these things because these are the things that we need. And as I would always say again, in order for make we do well in our society, we health is paramount. We health for be the first thing or for consider. For say, if you healthy, then you can go out there, you can go look for a job, then you can participate in things them we're going to make you better. We're going to make sure say you nation, you self give your own contribution to the nation. So again, we ask we government, yes, this problem not to them start them. It's been going on for years, right? But just because something don't they go on for years, no means say when you come, you take and say, that important. It's important because I'm sure during the campaign, there must be a moment when they touch on healthcare, when they touch on education. And these are two things that will really help we nation for how we go forward. And we really hope, say, then studies there, so then we'll continue for the DOAM, for how see exactly then report they are not. Now, other people, that if you think about it, would they listen? Now, other people then come in and try for do then studies there. So, and I'm not sure, I don't think they will just come and do these studies and then give us reports that doesn't make sense. We can go into this data or this research study. You can really see, say, the methodology where they use or the comparative, study, then compare around with other previous studies them for clearly show, say, now something way accurate, now something where they happen in our country, and we need for take them very seriously and see how best we will help people them. Now the provinces them, not to just Freetown. Freetown itself has its own constraints, right? So as we build healthcare institutions, not try for build healthcare institutions, now different district where be say, even if you know we're gonna Freetown, you go Bow, or you go Kenema, you go, Putlock, or any of these other district, then we're not too far from other district them. It go make them very easy for people them for stay healthy, for people them for continue for they, live their life, but in as much as we talk about it, we expect we government for come in first and put this in place and then see what else the citizens them could do. So for me, I believe say Sierra Leone deserve these things now, and it's like I don't know how else we need to talk about it, how else we need to advocate for it, for them to understand, health is what will keep your community or your country's economy grow, right? Because not to every healthcare institution get for offer the same service, meaning certain hospitals them then good at a specific health condition them, so sometimes you see when they transfer patients to other institutions them, right? So but we forget internal medicine facilities them way entails different specialties them, so that patients the way they suffer from heart disease, respiratory problems, kidney problems, you name it, and let people to understand, say, they wait only way you sick. Now the time for go to hospital. You for they constantly think about annual visit, especially when you reach at certain age. Certain screenings are recommended for you, whether you're a man or woman. You talk about preventative healthcare screenings or annual visit, just for go do your blood work. Make sure say your kidney function, your liver function, they're all good. Because as you age, some of them blood count they also get for become abnormal. And in many cases, we see patients them where they present to the healthcare system, where things then go at a very advanced stage. And with that time, what do you expect, or what do you feel say the clinician at this point go do? It go only try for give you treatment where it be say just for control your symptoms, but then it probably he or she cannot cure that particular illness or problem the way you present with. So now that's me get for say tonight, and I hope say things will change in Sierra Leone for the better. Thank you very much.
Thank you very much, Doctor.
You're welcome.
Yeah. We cook out Usfriend, make we waiting in get for it today. Yes, Usfriend, welcome on board, sir. You get the platform.
Yeah, thank you very much, Triple A. And thanks to Doctor, and thanks to Mr. Usmantoli for the contribution, and thanks to all our listeners and viewers. Main contribution on this regarding the health and this education, who IGR don't go do the report on education. I feel the aim now for learning will try get democracy. Because we see that the council now a group one a non-charitable group. But if they don't look inside education and health, then see say the indicators they wouldn't use for say if the thing reach or if fit for purpose. In other words, then try for see service delivery index. The index where the services they would have done the key towards that area they want for see what's at the outcome. In other words, what will give una money or what give una help, plus see waiting the help do ba. Now that one didn't go do so. Because then say then get partners them, and partners there at least then get UK aid when I defeat, even though they don't change the name now. Then get all the UNICEF can help them one time. Then get another thing standing together for democracy consortium. But this very free the health system here so nothing we be don't begin. I think in 2010 we in an Eskuruma be actually bring and through the help of this Irish government. By then I think one woman been did it. So but when they go up on this meeting, there was an idea what insects and the Eskuruma been get, because the literacy rates it been low and the fertility rates it been very high. In other words, women then they born more, the young one they born more, so they increase, and the education instead of the percentage only and they decrease. So now you get the idea. See, one for help them women they would belle woman they now till he born, that is journey now from where he get belle till he born, the pikin begin grow, then the young pikin there, and then he try for look into the other one the way that the younger the one the way not able for access. But the group what they began adding they disabled them. But this idea where he bring come, it was very good initiative. But you go see say responsibility sharing and knowing responsibility and knowing the purpose of any idea we wanna bring come, what's the purpose of that idea be, what's in the aim for do. But when they bring them treatment here, when they can't begin help just for quarter, they bring them drugs there, with the feed being help and what organization they help. Because it can't have London back, now they can't launch and then defeat themselves we get a project for help from about 5 countries there. So among them as Salon be daily. So then give them money there, would they help there? So other people in lobby now then go initiate this. So then therefore develop some other areas then. But the idea the first try in 2010. But immediately carrying drugs here, because among the drugs and because the area where the people they look into now the free access health. I mean they look so. The way they look about the other section is to where it be that condition they very not deplorable. Some areas they say they develop very slowly, but then they look now for this free one where they say that free force where they say free, how they look, and then the education where they say about the free education how it look, and the education sector from that period where they helped it now. So that's how they look so whether they go access them drugs, they are able to access them. But in 2011, I believe the ACC will detect this problem here. And when they detect this problem, and all the hospitals in Nabo, Kenema, Bombali, Kenema, Kono, all the places they are. I think by then, the guy na Felix Kaba, and that be the ACC by then. They flag this to the government. But they try for restructure a little bit. So when they begin trying for restructure now, but yes, still, they find out the drugs that they bring and they go sell them at their pharmacy there. Now, there the drugs that they go. Among them, because the free treatment, now just among them, amoxicillin, antibiotic, and metronidazole, that like we get them belly or them bacteria infection or belly, so they have 15 and they, what they call a flagell. So they have 15 and they, now in them, they try for help too. Not to the other treatment, like where you get a typhoid or other thing, then they actually pay. The only thing I'm gonna cost recovery government for don't put that one day for a bit. But let's add in a different sector. But the point here is that them drugs that we bring sooner, selected drugs, like if we get fever, they give painkillers and more fever, then they give you antibiotics. Those were the free drugs. But yes, still for all them drugs and they were selling them out, take to the vaccination. But you can still say by then the government, I don't know whose effort will they put towards curbing that area there, so they go able to stop that area there. Because they're able to stop that system, they continue. But the only method, like how they say, how they for don't curb that area there, now for able to put a kind of a pilot scheme where people then go come when you get a system of a data back, not to the one with the collection now of the government treatment of patients. When they treat you, they know they don't give them drugs there. Therefore, don't know them drugs there. Don't go to this because they enter each patient within date of birth or within in identification number we don't create for them. Because you go give an account, so you get possible they can't do that audit internally. Go no say I know about drugs, but if you go send somebody now in terms of that expertise, if you let go check now in detail, say how we able for deal with anything there, you not go able for no, because he then go give them an eye where you not go understand. Say therefore give this patient they are not more than 10 tablets. So if you go see you don't go get 100 tablets of paracetamol dangerous, then you go begin to doubt why who said that other 80 go. So all those kind of ideas then, because you know they get people that will know the department for go do the auditing, who go know in detail. Or then we know, maybe then they know will pass the message. So you get share responsibility. Who's that people and responsibility for them go know the nurse, you know, say I'm your responsibility this for that go look after the well-being of that person. Because when I get healthy nation, now I mean if I don't get blow, my heart don't blow because that person they well he fit, so they go able to go do another job. So all those kind of things the doctors have no say like yeah, I for do me own job. The pharmacist or the owner of the drug somebody who knows me own responsibility. The ministers they can't give them. Everybody know a responsibility. But when you see people and they lack They know they look the responsibility where they get in terms of their services. Then they look no more the responsibility of their own home, because the responsibility for a home now for let go put food na table. So for that you go fetch on hard for let go get in your living, it go back. But the responsibility for let go deliver now to the one we get and need the service, it become skint and very, very limited. But when you come to the idea now, sir, we will left the idea of why the government is saying they react to this side. So this is clearly now for CC the very issue we have been discussing as a UK and other government, then they try to reduce amount of help wouldn't they help now. And then secondly, defeat the one of them where in fact they don't change now to something else wouldn't they call Foreign Commonwealth and Development Office. Una FCDO, an office in acronym what was called defeat, but it's no more defeat from last year September. So when watching this organization don't can do what they can sit down, what they generate all this, so they don't generate a system when statistics they want for try get. That is the first thing when they do so now. Not so just for give money back now. Then they introduce what they call statistics on international development when SID. So then they focus mainly on the international, they measure the official help when they don't help each country. But if the government don't pick up that one, they know that this and they go on, then they will say, oh, then why try to belong because there was a time when the speaker he been get annoyed over certain people in the parliament say, well, he blamed them why who get this perception here, the donors who they give them money, they blame so on and so forth. But now it don't can be say that they hold the last resort now. Would then they come back to for say now would they look or accept say would the fair way for them would develop this year. But the only way we then go able to find the way for developer now for identify the area there and now for try the data system and try get them. Because for now it will be very hard for them to say if we don't pay them well, they don't get paid, they go forget side forget. But that is one of the way when I go reduce the amount so that we will focus that again on the area where we want to go do that how they call them cost recovery. For the other drugs and like for other treatments, because these are for just antibiotics and other things and so then they talk about. So the other sickness and they yellow fever, other sickness and they under problem they sick, then go try look into them where in the structure it will be built up for let it go able to go before. Then the education side now. Even then there's another organization who don't go there, saving the toilet system, they're not good, and all that fasting, and they pick up their rural area, they are all say this is what is going on. But all this they come back to the table of the area then with the people and with the give now the help, then they get for expect say that this they expect for now. But only hope say this you know go end up bad wherein because this is an aid, and when they come to a point where in the government that they give at least a percentage, people are not they give the full amount again. I think there's a certain percent where the government they give even a 30% certain amount what we don't miss towards this money out, and they put them together now for go buy them drugs there through UNICEF. Then bring them and can't give the people. So then at the deal one day they go on. So if government they wait till tomorrow and people can withdraw, and then the free health one and go they sick, they can't less halfway, then what's they happen now? Funds they for don't go for other side for develop when I will begin that fight then there because when I know they try for get a robust system for try cut down their system there. You know go easy, but then go find way then go curtail them. And that data system is very important. The way patient can hospital them prescribe for now use that method they. Even though because drugs they not go expire, for say they don't expire for it to then go get long term before they import them. So then go cover that time day. So all of these kind of things they see them, then begin to restructure now, how they restructure the physical side, the nurses, how they go deal with them, how they go able for encourage them in terms of their salary. Even though the government before they increase their salary, they were back with their cap, they increase small bits back. So that is the only thing I'm going for try look. But again, it go equates who side in terms of the economic side, because when you increase the money salary back, remember you get for develop the economy, because if the inflation they ever meet up with that in there, the problem it will always become. So that's why I go for they put side by side and they try to see how I will develop them so that God will able to help people and benefit from health. Let them go just they struggle in an environment wherein they don't deserve it. Thank you very much for let God continue for help we and let go before. Thank you, sir.
Thank you very much, Usfriend.
Yeah, most welcome. Yeah.
Yes, sir. Another thing say we want to say, Nayana Salon on this one. And the government, well, we go say Parliament don't say, then glad for the report, and then hope, and then hope for work with all and sundry, for work with everybody, we go able for make this one, the service delivery, reach the people them we supposed for reach. Somebody can catch me say, you know what he make? You know say, World Bank they inside this, Oxfam they inside this, all the other one they inside this. So sometimes money get for this, so I make Parliament self glad for work. I was like, nah, I don't think so. I think say Parliament self like the data. And like the data. Because they know say with data we can able for do more. Just like as Usman Tholi pick up, the World Bank representative, what he say? He said then data can help we for be innovative. How? You know, making statements them, it can easy, but for people them, you have to spell them out. How many times with you fumble there? Where you send money? Yeah? Let's say every month, you used to send $100. You send the $100. Then there's something going wrong. Then go still can call you, even though you don't send the money. Yeah? Send on a month money this. Example, $100. I don't send the money and the code this. The next day, then go still call you back. Say, oh, Granny, the atamu. Because you got to send the money specifically for Granny and Edat. Because that money where you send, not to be for Granny and Edat. That is the usual one where you be done to spend. Oh, we go say now the month money this so. If any other thing come up, now this money will not get for Bulamba. Like I said, do people learn you have to be specific. So where the World Bank representative just talk say, oh, I'm going to be innovative. Then go, okay, innovative. Okay, how? How go be innovative? But make we come with this scholar. Yes, scholar. You dey live on here. You name and side the call from, please.
This is not Mike. I call from Philadelphia.
Yes, Mike. You get up to 3 minutes, sir.
It's not just a waste of time. Man. A waste of time. What then they do? They just give them the study what they don't study, then go keep on. The problem with we Sierra Leoneans, not of us say we not get educated people there. But the problem is we're not able to apply the knowledge we get. Now the problem then even with the hospital and the education, we're not able to apply that knowledge there. Now the biggest problem is we're not able to apply so the people can go benefit. As long as we're not able to do that, unless even the past administration, this administration, they don't do boku study there. Look the traffic light. They don't do study there, but they're still not able to apply their knowledge then to the ground. And the biggest problem is again as alone. But they don't smell money. Money they around this tier. So all man go jump in there. They don't smell money. They do nothing. I'm not wasting our time, man. They do nothing but this, yeah? Nothing. Them people, yeah, man. And I just boku talk now what they do, man. Anything what they want to do, what they know say they go do. They don't get boku talk, pana. Yeah, and that's also boku talk, man. Boku talk, man. I'm your contribution, I know. I left for the full way, man.
All right, thank you very much, Mike.
All right.
Yeah. Access to drugs and the availability of the drugs. The availability, okay. Dana for the hospital. You come to the Salonia. You come to the school side. I think I said something here the last time. When we go Moyamba, we go na Usai na the holding center for the school learning materials. And inside the store, if you see the book they in Bokudi, like the store is literally full. And the person in charge turned to me. He said, I know say you want to say something, but they were. I say, exactly. I said, what did they still do now? Are they meant for the stores or for the classroom there? You say, oh, well, you know, we don't ship now the school them. Some of them are now the one way now for the hard to reach areas them. And also now the one that we left. But we they try for work out a scheme who say schools themselves where the government not approve it, but then can able go and watch, and with the Teaching Service Commission and other institution, then they can able for decide to, yes, you know it's in this school, even though it's not government approved, sometimes then they're on the verge for make government approve them, but they need them, then go give them people in there. Well, this time around, I don't know if we go in the back, make I go look. Because we want for Ben Wade, different sign now. So I don't think we go in the back for go look. But hey, anything can happen. Anything can happen. So you never know. Never say never. But like I said, it been did beaucoup. Eh? Put Salon first. You said people, you don't listen to the mayor in audio. Yeah, I think I don't listen. I see they ask who's stand for waiting. The mayor say, he said they're taking word out of context. Yes, caller, I live on air. Your name and side call from, please.
Yes, people. Nami?
Yes, sir. 3 minutes, sir.
Yes, sir. I'm not Charles from London. I see some picture there with the scroll Facebook. I just want to ask if not the Minister of Education I mean team up with them picking and this so.
You mean the one where we put
yes.
Yes, that's the Minister of Education, the time where we go to the provinces.
But I see the Minister of Education team up before the picking them. One intake phone, it look wise the man, but sometimes the man they talk to them. You know they pay attention self, in the phone no more interested in. I say this I can't understand.
Well, me, where I see that pictures there, because a picture where the Ministry of Basic and Senior Secondary School take, to me, your interpretation at that time, you know, say, na minister will like data. I say maybe sometime na ain't give them a website for check something. Now make you go see like now only one person they watch them, all the other people in the try for watching at the phone. Say maybe now because of that.
Okay, for that case.
Now, so me feel, I'm not to say na defense because I didn't take
understand.
But sometimes because I'm minister of data, sometimes a website tell and say let them watch her and see something where it try to explain to them because 3 eyes are on the phone, now only one eye there on them.
Okay, possible. Okay, now that number one for us. Thank you.
You're welcome, Charles.
Yeah.
Put Salon first. You ask about the audio. I think Usman totally don't say I'm right. You know, Saturday within everything goes. If you want to call and talk about them, it's good to go. Eh? And what else? We expect everybody for come on board for help the rural areas them. And right now, IGR point out certain district headquarter towns them, certain districts them where you feel say they are most vulnerable in these findings. And then they call to that organization and say, before they come, una can focus no more na Freetown, like Freetown is Sierra Leone. Una need for the areas. I think this data, if used properly, it will be good. That if the organizations them, then where they can pour money in the country, then work with people that are responsible to show them who side and feel say they help who you want bring come. Yeah. I know say help not they do for person. Help in not they do for person. We all know that. No, if you say na salon no more. The one the way qualify for the 1400. Not to back be they say if you know self they make 2,000. Like I be don't say enough for pull out at 600. They know to help how little, how large in not they do for person. If you see one help person, they say, no, left and no more, give that one day. Huh? Look inside the no more now. But what to make I say so that the people them where this report don't highlight, the areas the Moody's report don't highlight for the next 1 to 3 years, I believe so we need for focus day. But one good thing where we say both they do good now by education. I say for the past 5 years. So long no can take and say no more. Now this administration and for the past 5 years, they not they climb the ladder, which is good. We'll go check the. I think we need for go bad you. Hey. Let's see how it goes anyway. Let's see. Can't be everywhere at the same time though. A small. But maybe you can go check there and see what's in the ground there. Don't forget, I am a Sierra network. And they don't build the bridge. Okay. About to kick about say how can organization go when the road not good? For them, it's hard to reach areas. About the help at them where they come. That's true. Bendu Kamara say all them public officials they're very much aware of the problem. They really need for work with people them. That is true. I make about to kick about talk about the hard to reach areas. They can't get the name like for say it's impossible to fix those places. Even when it comes to harvesting. Some of those areas then good senade they left. But again, they not go sell to themselves, make them enjoy back na the village. Then go they days back they suffer for pull am come on at the village, come back na tongue. Yeah. Salon in case you see yourself. Talk and go talk and crab. Salon matter. Funny. But we're still hopeful though. We're still hopeful. And I make that word where people like you say, oh, who side they be there? Oh, they're not talking nothing, no. Because every day when things happen, we come here, we talk about it. Let us not say 5 years time. People still can say, oh, they not be the talko. Says who? So I make, even when they use that statement, I know they again now anyway. Before, outside them be they not be the talk. Says who? Says who? Who that say they not be the talk? So you not be the listen where people they talk. Yeah? Because we get sifter. We receive waiting we want for absorb, and the other one will say na chaff. A chaff na for to go away. But how people fight for political party, I don't get it. Maybe God I did that one deep on me. To be frank, I don't get it. How people fight for political party, I don't. Because I don't know with what thoughts, what's in the rationale behind that, I don't even know. Rather than fighting for your country, rather than being patriotic. No man is an island. No man stands alone. I will repeat this now again because I don't talk on so many times. Your political party can't make Sierra Leone. But we Sierra Leoneans, them, if we come together, we're able to make Sierra Leone a better nation. Your tribe can't make Sierra Leone. You one grain ideology can't make Sierra Leone. It's collective effort. You say like how can come, everybody put you on a table, and so for do. Collective effort. We come together. Say we want Sierra Leone to be a better place. Sierra Leone will be a better place tomorrow. You say Sierra Leone too big? Not true. Let's start with our community. Can we work together? Say we get to our own community center. We healthcare center in our community. Can we work together? For make we healthcare center be one way people go emulate. You get young man in area when they do nothing. You got other people then can able provide drum. The young man in the morning they go get water they can full up. So that way the belly woman then go, so that way the people they admit in the hospital or at the center, they able to get access to water. Instead of go sit down no more the alabra you body. There are so many things that we can do. Community level, local level, we'll go able for help we self and empower we heirs them. But you don't see, you don't go try for going to the provinces, you get certain heirs then, small picking them. Small picking them. Then they take rope, then tie na the road, say then they put stone. So when you car come, you go break, you give them something. Small picking them, we don't want anything. Where you left hand and then you go small, you meet the big one there. Yeah. Then they see them as they see Mutuka, they come from afar. Then grab. Then begin make like say that they put stone there. The way can when they work so they do all day. If you feel say una want for make road, una come together. Because now where the road make, now go make people in Canada on a community. But you get community then. Inside this 2021, inside week, now one time motoka they go inside, now one time they come on a do. Then one day they overload. One time per week. We see the motoka go inside so one time. They say don't come. Sometimes per family, now one person. And they pick who that they gonna tongue. Now the proper hard to reach areas at the table too. It's there in Sierra Leone. And the motoka will look and say, hey, Papa God. And never say I for come inside the city. No. And for just come, maybe Usai, you go able can get the bike, or Usai, you go able to get motoka for go to the district headquarter towns. Or some of the communities then, na bike no more the goodie. Because the road also damage that even motoka no the good again. There are communities in Moamba who talk to the bike riders. Then they charge 60,000 per person. If now not two, then they charge 40,000. But if now you have 60,000 per person, for can you go inside? Because it's in the motoka no the goodie, na bike no more the goodie. So imagine, they all go can and get a one. They send one person. So there you go. So can you imagine how you feel say education and health care go turn at then kind community then they force? How you feel say then go turn? And this community, if they manage, forget cell tower where they go able catch for their cell phone. The top up or the credits, the amount different yonder. No go fast safe. You see that village where Triple Bingo, that school, where na that football area. Yeah? The top up, the man with the cancel top up inside that village there. When I waka, the waka. 1,500 for 1,000. You get 1,500 there, put 1,000 top up on your phone. In the get, if na 2,000, it get you how they do. Get you how they do. But not to 1,000 for 1,000, no. Again, your own commission on top. So we go to the more hard to reach places. So on side and day before you get 2,000 credit, if they manage it, until you don't spend 5,000. That's how difficult it is for those people living in those neighborhoods. I made them say hard to reach areas. Ezekiel say, what about them when they go reach out to you and tell you say they want to do business? And we go ask her, what's in the capital? And tell you say $3,000 to $5,000. Rather than capital for do business. Okay. But me in that area, I feel to say, before they pull 30 to 50 million for give somebody, if I don't give them responsibility with small thing first, and see how we grow with them. So until we're not able to say, you know what, I left and give you, my dear, not even try them. Me na so me don't do me business so. If I'm not able to say, you know what, forget it. Just hold and just go. I'm not doing it. So we need for start from that one day first. A small one. Where Kalu go kind say, I say, they go no more now. Now you see I'm big, continue. So man go come to say, oh no, 500,000, 1 million, 1.2 million, 2 million. At the end of the day, after 1 month, ask them. All them will say, oh, now that's where that problem become. Now the money will be the take part. That's it. Now the money na don't so. But watch the serious business people them. They will grow that money for you. With no excuse. I'll go down with today, you know. I'll go there back tomorrow. Tomorrow is going to be an interesting topic with the story time. Very interesting one. We're going to talk like one family, and this is not diaspora, you know. Just in the line of waiting Ezekiel asked just now. Yeah? Parable story time experience. Matthew, I know be say with all them post situation and then community how they talk about so still yet ACC now make them parliamentarians then pay back the country money. ACC say they use her. They not be telling say for can't complain waiting them for use them for. Eric George say, he say when they work as humanitarian, he say them be don't work na areas them way na only NGO go able for access them villages and they. And are the only way that they way the people in the village they see them white then call them dog face. That's what they call the one then the dog face. The NGO. It's Nissan. Is that Nissan? No, not Toyota. Then the Toyota Hilux, Toyota Patrol or something. But then call them dog face na salon. Where they feel say any kind of the road turn then they go there. When do come out they ask if they get serious business people in Sierra Leone. They do. They do. Now I make I say tomorrow whoever can talk like one family them. For one reason, people we get connection with the diaspora. La lefandi. I just lefandi, yeah? Tomorrow, story and parable time. Yeah, we can't talk now. Yeah? Story and parable time. Because it's like say, as long as they don't say, oh, brother, sister, cousin, and auntie, they oversee, I don't care what you do. Then they take and say, what this doing, they send back. But the people will not get any connection, they'll struggle. You'll see them struggling. Go to Abacha. People that within Abacha, you say, they're serious business people. Go to Guinea store. There are serious business people there. But who the oversee who fumble and fail to say, that monthly money always they cancel. Why the fuss? Yeah. I think in shock we. Go there back tomorrow. Don't miss tomorrow program, yeah? It will be very interesting. And then between we and the diaspora and the one in a salon. We can give we we experience them and how we feel say we fix them. Yeah? Till we meet again tomorrow. People say, ta-ta.